Hello class, my name is Anna and the topic that I chose for my disability presentation was autism. So what is autism? The IDEA defines autism as a developmental disability significantly affecting verbal and nonverbal communication and social interaction, generally evident before age 3, that adversely affects a child's educational performance. No two people with autism are exactly the same. What causes autism? There isn't a single cause for autism, but research suggests that autism develops from a combination of genetic and non-genetic or environmental influences. These influences appear to merely increase the risk of autism, and we have to keep in mind that increased risk is not the same thing as a cause. Genetic risk factors. Genetic mutations increase the risk that a child will develop autism. If a parent carries one or more of these gene changes, they may get passed down to the child. Other times, the genetic mutations can develop during early pregnancy. And even if the parent isn't autistic, it can be passed down to the child. Environmental risk factors. There are certain environmental influences that may increase the risk of autism, but they have a small influence on the risk. So parents that are older have a higher chance of having kids with autism. Pregnancy and birth complications, so babies that are born at a low weight or babies that didn't get enough oxygen in time to their brain, and pregnancy spaces less than a 1 year apart. I'd like to note that vaccines do not cause autism. The Academy of Pediatrics has compiled research proving this, and we can click on the link and it'll show us a whole list of studies proving why vaccines don't cause autism. Statistics for autism. According to CDC, about 1 in 59 children has been identified with autism. It is reported to occur in all racial, ethnic, and socioeconomic groups. Autism is about 4 times more common among boys than girls, and about half of the children identified with autism has average to above average intellectual ability. So that stereotype that autistic kids are not smart is very outdated, and a lot of the time they are much smarter than we expect them to be. So autism is a spectrum that travels between severe and mild. Kids with autism can be anywhere between nonverbal to verbal. Every individual on the spectrum has problems to some degree with social interaction, empathy, communication, and flexible behavior. So we have high functioning autism. Those are going to be the kids that are verbal. They're going to need some support. Their communication skills and repetitive behaviors are only noticeable without that support. Then we have autism. They need substantial support. The patient's social and communication skills and repetitive behaviors are still obvious to the casual observant, even with support in place. And then we have severe autism. This is where kids that are nonverbal are going to fall under. And again, the child is going to need substantial support. Their social and communication skills and repetitive behaviors are severe to the point where it'll impair their daily life. They'll need that constant support. And again, it's the kids that are nonverbal. Then we have the diagnosing of autism. It begins with a developmental screening. There's no medical test, such as like a blood test, to diagnose the disorders. All children should be screened for developmental delays during their well child visits at 9 months, 18 months, and 24 or 30 months. Developmental screening and questionnaires such as the Modified Checklist for Autism in Toddlers, or MCHAT, help identify developmental delays. Questionnaires like MCHAT are quick and brief and are not meant to be considered a diagnosis. And then the next step for a diagnosis is a comprehensive diagnostic evaluation. So the next step for a diagnosis is a comprehensive diagnosis evaluation. This will be a thorough review of the child's development and behavior. Some doctors might prefer to refer the child to specialists such as a developmental pediatrician, child neurologist, and child psychologist or psychiatrists. The evaluation will include interviews with those who interact with the child, so the parents, teachers, child care, and so on, hearing and vision screening, genetic testing, focused observations, neurological testing, and other medical tests. So one teaching strategy that I found is structured teaching. Division Teach, training and education of autistic and related communication handicapped children, is a program serving individuals with autism in North Carolina that developed a teaching technique called structured teaching. It is a 5-level teaching technique. Next slide. Structured teaching strategies capitalize on the strengths of students with autism. These include providing predictable and meaningful routines through the use of structure, adding visual structural supports to classroom instruction and activities to increase engagement and independence, and clearly organizing classroom spaces and teaching materials to reduce anxiety and increase appropriate behavior. So if we go back to this one, we can see each level of the teaching, of the structured teaching. And it focuses a lot on visual support. The other one I chose to talk about was ABA therapy. Applied behavioral analysis is a therapy based on the science of learning and behavior. It assesses and evaluates a student's behavior and applies interventions to try to alter behavior, from understanding a behavior's function to controlling the student's environment. It can be adapted to meet each unique need of an individual. Elements of ABA therapy include intervention designed by a trained behavior analyst, development of treatment goals that emphasize achieving greater independence for the student both now and in the future, training for parents and caregivers so ABA can be continued in the home, abundant positive reinforcement for desired behaviors, and an absence of reinforcements for behaviors that impede learning or may lead to harm. The two things that stood out to me about ABA therapy was the goal planning for the future. So it doesn't just focus in classroom learning. It also looks towards the future of the child and the daily life of the child in the future. And then the second thing that I liked about the ABA therapy is the absence of reinforcements for behaviors that impede learning or may lead to harm. So sometimes kids with autism have a hard time communicating with us, so they turn to tantrums and such. And with ABA therapy, they purposely don't acknowledge such behavior, so slowly the kids will learn that tantrums and yelling and crying and all that stuff isn't correct, and it's not going to get them whatever they want. Now we have low tech support. Kids with autism often benefit from visual support, and examples of visual support that don't involve technology are dry erase boards, calendars, photo albums, highlight tape, 3-ring binders, anything visual or hands-on that will help them organize and have a routine. A constant routine really helps kids with autism. And we have high-tech support. Technical support strategies such as video cameras, computers, and complex voice output devices. This technology can be used to develop language and social skills. I feel like high-tech support would really help kids with nonverbal issues. The use of computers or iPads by children with autism could increase attention and focus. And well, of course, this has to be done very carefully, because we can't have the kids get used to too much to the technology, because then it's going to be an issue to try to get them off the technology. And these is my references, and that is my presentation. Thank you.